I think a couple of things. It's an option. And for some people, it'll be a very valuable, important option because alongside thinking about children's mental health, they will be able to get an additional take on related issue, stress. Scale developers like myself, we think of these as potentially very similar until proven otherwise constructs. And so we've been interested in stress for several years. And it's taken us a while to develop good items. We thought others had already done this, to be honest with you. The National Institute of Health spent nearly 6 years in developing a set of stress measures called PROMIS that ended up not having much promise, as it turned out. That was their conclusion, not my conclusion. So it's been a difficult thing to nail down. And so my colleague Chris Anthony, myself, Jim DePerna have worked hard at crafting items and in the keeping of the mindset of a brief scale. We wanted to get the most information for the least amount of time. And we were able to, using item response theory, identify 5 items that teachers, parents, and students all agreed were good indicators of stress. And so that's it, just because you can do it doesn't mean it's a good thing to do. So why are we so concerned about stress? Well, there's a long literature dealing with children's mental health and early childhood stress and trying to understand how is it that some children survive that and adapt to it and others don't. And so we started looking, and lo and behold, there was a bunch of literature on stress and discovered that there's some pretty good frameworks. I wouldn't call them theories yet, that were coming out of the Center on the Developing Child at Harvard. And it really touted that there were 3 elements that you really wanted to focus on if you wanted to maximize the likelihood that children grew up healthy and happy. A couple of them we'd already been doing. We already were concerned about social relationships and developing responsive relationships with adults as well as a close friend or peer. And we were already interested in self-regulation and self-management. That's what we did with SEL measures. But the third piece that they talked about is stress management and stress reduction. There are some direct things you need to do to manage your stress. And so that was missing. So here we measured SEL very well. So we're interested in trying to maximize the frequency that children exhibit of that. And we concurrently were interested in decreasing many mental health issues. The interesting thing is, a lot of people will tell you that stress precedes mental health issues. It's not a mental health issue per se. If when you don't adapt well to stress, you start exhibiting many internalizing difficulties in particular, some externalizing, but stress is much more strongly related to internalizing difficulties. So, say that child's got an internalizing difficulty, which you could do with the SEL brief and mental health scales, but you weren't really getting a measure of potentially the causal issue, and that was stress. And so we said if we can identify 4 or 5 items in the spirit of this brief screening measure, along with 5 internalizing, 5 externalizing, we kind of have a set of mental health indicators, and that's what we did. And so, any of our existing customers that are currently using the SEL mental health, they would be encouraged to also add in these additional 5 items. The way we're offering this currently is under this umbrella of stress and resilience, because that's where the research is driving this. The point is, for less than a minute and a half of extra time, you get a measure of stress alongside a measure of mental health in SEL. But the issue is efficiency. And if you set up to do a screening, why not capture the critical behaviors in one effort as opposed to piecemeal? In addition, from an interventionist standpoint, that's actually the only reason we do assessment, is to come up with some actionable data that can drive good instruction and good intervention. And it makes sense to look at stress as it's contextualized alongside mental health issues and social skills or social emotional learning variable skills, because it's going to create, for some of us who are intervention savvy, it's going to give us critical information that helps guide instructional practice.